So happy Monday. We're honored to have you with us this morning. We hope everyone had a safe 4th of July. Over the past week, Alabama's total number of COVID-19 cases rose to exceed 43,000. Fall is just around the corner, and with it are the questions about how we will face the upcoming months. Together, we will navigate these situations together. In the meantime, it's crucial that we each do our part by wearing our mask. Let me say it again. Wearing our mask, practicing social distancing, and remembering proper health hygiene. Today, we're thankful to have with us County Commissioner Ray Long. Chairman, thank you for joining us today. We look forward to receiving an update from our county partner. And then we have with us our Chief Nursing Officer with Decatur Morgan Hospital, Anita Walden. It's been a while since you've joined us, and we're glad that you're back. We look forward to getting an update from the hospital. So just a few reminders that in Morgan County, our cases are 1,102, which means cases increased by 20% in the past week. In order to stay safe and well, we will all have to do our part. I mentioned this before, and I'll say it again. We must continue to work together to socially distance, wear our mask, wash our hands, and disinfect. It's through the completion of these crucial steps that we can keep ourselves well, keep our families healthy, and sustain our local economy. And we're happy to serve you here at City Hall. If you can, please reach out to the departments that you have to do business with first by phone or email. Many trips can save you time by making that effort. Facial coverings are strongly recommended wherever you may go here at City Hall. If you haven't already done so, we encourage you to complete your census at my2020census.gov. Let me repeat that, my2020census.gov. This is crucial for our state to receive the allocations, representation in D.C., and funding our communities need. Also, call someone in your neighborhood, especially the elderly, and check on them today. Remember, if you have any questions, you can reach out to your city council representative or me. Our information is available on our website at DecaturAlabamaUSA.com. As always, I want to encourage you to support our small businesses in whatever capacity you can. Our garbage routes are operating as normal. And with that, I'd like to pitch this over to Chairman Long.
Thank you, Mayor. Last week, we announced we were starting a program at the courthouse where everybody that enters the building was going to be offered a mask. And I want to say that is going over good. It's still going on. We've got somebody at the first floor and the second floor, and I'd say probably 95% of the people that don't have a mask will take one. You have a few that has medical reasons that they claim, they say they don't want to wear them, and we've had a few that just said, I don't want to wear a mask. So we're not wrestling anybody to the ground to make them wear one, but 95% of the people are taking them, and we want to do our part at the courthouse to try to keep the virus out of the courthouse. That's a very vital service that we provide over there for your course, your tags, your license, all this, just as City Hall is important here for the mayor. So we are doing what we can to make sure that everybody has them. Now, if you have to go to a courtroom, the judges are actually requiring a mask. You can't enter the courtroom without a mask. And so, people that have been down, we've had a few that didn't want a mask when they come in the door, then they come back and say, well, I think I need one. So we encourage everybody that comes to the courthouse to take one. They're free to the people coming in, and not free to us, Mayor. We're having to pay this, but it's worth it to do our part. Still have a line, people buying tags. When I come out, there was probably 25, 30 people out buying tags, and you can do that online. I want you to know, my wife went online this morning and bought ours. It takes about 3 minutes, just 3 minutes. And I know I could have got mine at the courthouse because I worked there, but we just wanted to see how simple it really is. So she went online this morning and purchased ours in about 3 minutes, and that's a lot better than standing in line. And it's free. I mean, as far as extra fees, you don't pay anything but just what it costs you to buy the tag normally. So do that and save yourself from standing in line. I mean, we really encourage it. everything else, Mayor, is going good. I mean, our garbage service is going right on. Recycling, everybody's proud the recycling's opened back up. We've got our bins back out and going, and that's just, the more we can get back to close to normal. We'll never be back to what we consider normal, but the more we can get there, the better it's going to be. Even our parks this week, we had a beautiful weekend. But people was being respectful of each other. Rode around, seen a few, and the playgrounds. I mean, we can't clean them every few minutes, but people was being careful and stuff. So we like to see that. As we've said over and over every week, it's up to us individually to make a difference. We can't expect government to make a difference, and we can't expect our neighbors. We need to make the difference ourselves. And so if we continue to do, as the mayor says, keep your mask, keep your hands clean, and just social distance the best you can. And we're going to get through this, Mayor.
We are. So Sherry and I, we had a tag to order, and it was easy, as you said, but also we received our new tag within 3 days. So it just came in the mailbox.
They're processing them as quick as they get them. And, that we want to encourage, we don't want it just to be going on this year. We want people to do it from now on because it's so convenient to do that. And, we've all got things we could do other than stand in line to buy a tag.
Thank you, Chairman. Nita, thank you again for joining us, and we look forward to receiving an update from the hospital.
Absolutely. Since I was here last, our cases have gone up significantly. But first of all, I want to thank the City of Decatur, Morgan County. The support from everyone has been just phenomenal, and we appreciate it. That continues to come in. We even had some parachutists last week, which was really cool, and all of our healthcare workers really appreciated that. I want to thank our Morgan County, Decatur Morgan Hospital team and our system. We have worked so hard together. And I'll have to say, since this started in mid-March, for us, our team has just gotten stronger and stronger. And I really appreciate that. I think I've told you before, we have a system call every day. And we share with each other our cases and any problems that we might be coming against. That has been very helpful and has increased the team spirit, I think. And between all of us, we've been able to meet all the needs that we've had. Our care teams have worked tirelessly on the COVID units. It has been very difficult. They are wearing masks, face shields or goggles to protect their eyes, long gowns, shoe covers, and they have to keep these on for 12 hours. So that is tough. It's a hot job. But I'm proud to report that our team is going strong, and they've done a great job. By the numbers, today we have tested 1,518 people at the hospital since we started this. We've had a total of 178 positives. Today we have 23 positive inpatients, and we have 19 that are under investigation. Well, that means they've been tested, we're awaiting the results. So that's a lot of patients to take care of. Those PUIs are persons under investigation, we treat them the same as if they were positive. So that means all the PPE that we spend on the positives, we also use on the PUIs. Our fever clinic in Hartselle, you don't have to have a physician's order. You can bring a photo ID and your insurance card. We have tested 745, and we've had 26 positives so far. We have several tests still pending that we should get back today or tomorrow. In Alabama, our positives for Alabama are about 11.9 or almost 12% of the total tested. That's a pretty high number. Hospitalizations are very concerning. From the end of April to the end of May, there was an increase of around 12 or 13%. From the end of May to the end of June, there was another increase of about 12.5%. From June 25 to July the 2nd, that was only 8 days. There was an increase of 18%. So I encourage you to go out to the dashboards and look for yourself. The numbers are very concerning, and it's what we've heard. There are things that we can do to prevent the spread, and I just think that a lot of people have not educated themselves yet on how this virus spreads. I will get to that in a minute. It's been about 120 days since we started this journey, and about day 16 at the hospital, we had our first positive patient. Until the last week of May, we thought that perhaps Morgan County would escape the heavy number of positives that were going on in the other part of the state. We were wrong. Completely wrong. During the last week of May, we picked up about 8 or 9 cases per day. The first week of June, we doubled those numbers. We've averaged about 20 positive cases for the last 3 weeks. One day at our highest point, we had 26. In addition, we've had about 7 to 20 PUIs every day. And as I said before, the PUIs require the same kind of PPE that we would deliver to any positive. We do have a designated COVID unit. The sickest positives are in the ICU. Some are on ventilators. Today we have 2 patients on the ventilator. We've been very fortunate in that we have excellent physicians, and from day one they have said if we can possibly keep a patient off the ventilator, we want to do that. It's not good for the patients. However, when they get to a certain point and that there's no other alternative, we do put them on. During the Memorial Day gathering, we saw a spike within 8 days to 14 days past then. I'm fearful that our Independence Day gatherings could cause another spike, probably will. Hopefully, more and more people are taking this seriously, and they were careful to keep those gatherings to a minimum. Our patient volumes in the hospital are still decreased for around 20% for regular patients. However, we did see a slight increase in June. Our surgeries in June were at our budgeted volume. As you know, we stopped elective surgeries altogether for a while, but when we did start back, we have been working a backlog, and we're trying to catch up there. Our visitation at the hospital continues to be limited. Of course, we allow people in for end of life and compassionate care. Patients are allowed a caregiver as needed. Our L&D, or labor and delivery patients, can have a support person with them, and every child can have a guardian or their parents with them. But again, anytime anyone comes into the hospital, their temperature is taken, they're given a questionnaire, and we're very careful. We want to make sure that we're not spreading the virus needlessly. Team member safety. Everybody that comes into the hospital is required to wear a face covering, and that is every employee, every physician, everyone. If you are in a patient care area, those masks are a surgical mask or a procedure mask. And then if you're working with COVID patients or PUIs, those are N95 masks. So there's a difference in the type mask that you would wear. Our team has done an excellent job of keeping themselves safe from exposures. However, when a possible exposure happens, we have a protocol in place that we follow. We determine if any exposure is a high risk or a low risk, and it goes through an algorithm to do that. A low risk calls for self-monitoring for symptoms. A high risk calls for testing, a quarantine, and of course self-monitoring for symptoms as well. So what are the symptoms? The CDC has added to the list since the very beginning. So some people have no symptoms. They're asymptomatic. That is the worrisome part for us. There's a lot of people that think they feel fine, don't know they've been exposed, they're not wearing a mask. They're talking, they're singing, they're laughing. All of that spreads the germs. Fever and chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, loss of taste or smell. That's in a lot of the patients. Sore throat, congestion, runny nose, nausea, vomiting. We've seen a lot of patients with GI symptoms. Diarrhea. This list does not include everything. The CDC continues to update it, so I encourage you again to go out to the CDC's list of possible symptoms. I've had many people call or text and ask me, is this a symptom? What do you think? My answer is anything is a symptom. Monitor yourself, be careful. What can you do to help? Wash your hands frequently. Every time you touch anything and touch your face, you have just put yourself at risk. For parents, when you touch anything and touch your children, you're putting them at risk. Social distance from everyone, even your family. It's hard. My mom is a hugger. It's so hard for her to not give everybody she sees a hug, even us, but she's learning. Keep at least 6 feet or more between you and the next person. Germs and the virus spread through the droplets, so it hangs in the air. So just be aware of that. Wear a mask. Please wear a mask. That is not to keep you from getting the virus. It is to keep my germs from spreading to you and anybody else that might be around. As the mayor already said, we're in this together. When we first started this, it sounded like kind of a cliche. It is not. We are in this together. Please, let's work together. Thank you.
Nita, thank you, and know that you and the team at Decatur Morgan stay in our prayers.
Thank
we
you.
Appreciate the
We
work.
appreciate that.
Yes. So just, I heard some data, some numbers. Those are specific to Decatur Morgan.
Yes.
So whenever we look at the county, the numbers will be larger.
Oh, yeah.
Okay.
Oh,
Very
yes.
good. All right. Well, thank you so much for joining us today. So do we have any questions?
I actually have questions for all of you.
Okay.
Anita, I'll start with you if that's okay. First, you said, so 23 positive patients, 19 under investigation for COVID. This is the most that the hospital has seen since COVID began. Is that correct?
Not necessarily.
Okay.
Every day, we've averaged about 20 positives a
Okay.
day. Yeah.
I guess for these numbers, what does this tell you about, one, how people in Morgan County are dealing with this virus, and two, just the magnitude of this virus in general?
Morgan County is still not as high as some counties in Alabama, which is good. I think the issue for us is that as we see numbers rise, it makes us aware that the virus is out there, and that as people get more comfortable going back to shopping, gathering, all those things, that we're going to see numbers rise even higher. That's what has happened in other counties, Mobile, Tuscaloosa, those places, Marshall County. In fact, Marshall saw a sharp decrease, and then they went right back up. So we can't let our guard down.
With 18% of hospitalizations, the hospitalization rate just continues to climb. Last week, we had the highest hospitalization rate that we've ever had in the state. What's your biggest concern with those numbers and just seeing those increased hospitalizations?
Well, you know, we still have sick people in our community that are not COVID positive or not a PUI. They still need care. We cannot afford to fill up all of our beds with COVID patients and not have room to do our elective surgeries or take care of our sick people. ICU beds in particular worry me a lot.
Tonight, the city council in Decatur is again talking about a possible mask ordinance. First question on this is, what are your thoughts about that?
I'm completely in support. No question. We have asked people to wear a mask from day one. I don't think about this as infringing upon my rights. When I don't wear a mask, I'm infringing on your rights. I'm getting you sick, and that's not okay. But we've got to care about each other. Think about kindness and humanity. Wearing a mask is for I want to protect you. I would appreciate if you would protect me. So I hope it passes.
I talked with the doctor in the Huntsville hospital system last week because the big question people have are, well, I have a medical condition, I can't wear a mask. He told me that there is a 1 in a million chance that a doctor or healthcare physician would actually tell a patient that. Can you talk a little bit about that?
When I hear that people have a condition that keeps them from wearing a mask, I'm thinking that's exactly why you should be wearing a mask. Absolutely. People have an idea that when you cover your nose and your mouth, you can't breathe. That is not the case. You just need to try it. Practice at home. There's things that you can do. You make sure that your mask is pulled out so that it is not right against your nose or your mouth. I encourage people that have underlying conditions, please. It's so important that you wear a mask.
And my last question for you is, you talked about the importance of getting tested and quarantining if exposed. I know a lot of, especially the younger population who are coming up more asymptomatic, are just saying, no, it's fine, I'm not symptomatic, I don't have to get tested. Can you talk a little bit about the importance of, even if you were in that low risk exposure, how it's still important to, 1, quarantine, and 2, get tested?
So for anyone, the whole point of getting tested is to know for sure, do you have it or do you not? Because you need to think about, even if you're going to be fine, even if you remain asymptomatic, those that you're around, your parents, your elderly grandparents, other people with underlying conditions, they're the people that are at risk. So think seriously. If you don't want to be tested, that's fine. But take yourself away from other people.
Mayor, I wanted to ask you about your thoughts on the mask ordinance. I know it was discussed last week. We've seen these cases continue to rise, especially in the last month. And I talked with Judy last week, and she said, July 4th is going to be another one of those holidays that is concerning. Anita said the same thing this morning. What are your thoughts? Have they changed? Do they remain the same on enforcing, patrons to wear masks in public places?
So, Jenna, we've received a lot of inquiries about masking over the holiday weekend. Governor Ivey has an order that is in place that includes 6-foot distancing and 50% occupancy. She could very easily add one sentence that covers masking for the state and not put that on municipalities where it would be very challenging to enforce. I don't know if anyone can show me anything that's documented showing that municipalities that have mandated the wearing of masks have had a reduction in positive testing. I'd welcome that information. So with that, I believe that those that are going to wear masks are, and those that won't wear masks aren't.
So you do not believe that we should have an ordinance in the city of Decatur to require masks?
I believe Governor Ivey should help us with that, not to pit municipality after municipality. So let me give you an example on that, okay? So in Morgan County, we have Somerville, we have Hartselle, we have Eva. We're the county seat. Are they going to mandate a mask ordinance? Or whenever they come into the city limits, will they know to put a mask on? Athens has elected not to. Huntsville did it under their health department process. We are not able to do that because of the makeup of our health department. So I just want to give some of the challenges that we deal with. And one last thing, and by the time our police department is dispatched to a business, because someone will call, and that's going to cost us a 911 call. And by the time someone's dispatched and the officer arrives, where will the subject be? You know, will they still be there or likely gone? And that that's, I don't know if that's just, if it's enforceable.
Is there another solution that you can think of?
To exactly what we've been talking about. Just be responsible and put a mask on. Not because you have to, but because you want to, because you care.
So I guess at what point, does that cross the line? We've been saying, social distance and wear a mask for months now, and the cases are worse in Morgan County than they've ever been.
I don't know the answer to that. I don't think mandating is the answer.
The statewide. Okay. Thank you, Mayor. Chairman, question for you, again, back to the county. It's not just Decatur that's seeing these cases, like Mayor Boland said, it's the entire county. Is there anything that the commission can do or is considering to require masks?
We're not considering anything as far as requiring masks. We believe that we need to put the burden on the people to protect themselves and protect their neighbors, and we've encouraged that, and I know our numbers are going up, and like I say, and we say every week how serious this virus really is. It's something we can't see. We know there's no way to control it other than your mask and staying clean and stuff, but we have, that burden needs to be on the people to mandate yourself. And really, when you look at the big scope of things, I don't want to minimize it because it's very serious with those people in the hospital and stuff, but the numbers that we have with a county our size, 120,000 people, the percentage of people that's had it, and those that had it in the first few months are already well, so we really don't have 1,000 people or so walking around with it right now. That it's a rotating circle where some are getting better than other people are catching it. So for us to put a mandatory mask, we're not going to at the county. We encourage, that's why at the courthouse when you come in, we offer everybody a mask. And so when they come in, just protect our people, protect the citizens that come in. But we've took a lot of other steps at the courthouse. We've got we got glass barriers up. All the employees have been given gloves and hand sanitizer. I mean, we have it out for the citizen when they come in. When you come in the door, there's a hand sanitizer for people to clean their hands on the way in and out. So we're doing, all that I think we can do. I don't see us mandating a mask in the county.
Is that true, Anita, that the numbers that are on this, the Alabama State Health Department's website are not current numbers? That's total cases since this has started?
Since it started.
Okay,
Yeah,
so there's not.
Now the ADPH has a dashboard, and you can get daily numbers, or you can get cumulative.
Right, and those daily numbers are in the 900s.
I believe so.
Okay, just want to clarify that. Thank you.
Sure.
Thank you. So with that, our next press conference will be Monday, July 13th at 10 o'clock. Be safe, wear your mask, and have a good day. Thank you.